Hello, my name is Dr. Dewan S. Raja. Today I will discuss about lumbar puncture, also called spinal tap. What is the definition? A lumbar puncture, often known as spinal tap, is a medical procedure used to draw cerebrospinal fluid from the subarachnoid space of the vertebral canal in the lower back. Indications for lumbar puncture: to diagnose neurological disorders such as meningitis that could be bacterial, viral, fungal, encephalitis, multiple sclerosis, maybe Guillain-Barré syndrome, maybe neurosyphilis, and maybe subarachnoid hemorrhage. To assess increased intracranial pressure when there is suspicion of elevated intracranial pressure, but extremely increased intracranial pressure is also a contraindication. Administration of drug directly into the CSF, it may be anti-cancer drug, it may be antibiotic, or it may be an anesthetic. Excess CSF is removed to ease the symptoms of illness like hydrocephalus. Preparation for lumbar puncture. First of all, we must get the consent from the patient, and we must discuss the purpose of the lumbar puncture and the possible drawbacks. We also be alert, specifically the medical staff, to know about the allergies, underlying illness, and prescription drug being taken. Allergy may be due to anesthetic substance, may be due to antibiotic, may be due to anti-cancer substance. Allergy may be due to contact of the latex particle to the puncture site. Okay. And the position should be fetal position. The knee should go up close to the chest. This part will be carved so that the space between the vertebral spine will be more. And also this is another procedure, sitting and leaning forward. So the spinous process, the space between the spinous processes will be increased so that we can easily pass the needle in between the spinous processes of the vertebra, lumbar vertebra. Okay, we have discussed the positioning and local anesthetic to numb the area. Inserting the needle, idea is there to reach the subarachnoid space. Okay. Typically, the needle should be passed between L3 L4. In case of neonate, it may be L4 L5 level, because in neonate the spinal cord ends at the level of L3. In adult, it ends at the level of L1 lower border, may reach to L2. That's why for adult, this or this. In case of newborn, this is preferred. Collection of CSF. Once the needle reaches the subarachnoid space, CSF is collected. The pressure of the CSF may also be assessed. Closing. Following collection of required volume of CSF. Required volume, it depends on the age, physique of the individual. It may be 5 ml, maybe to 30 ml. According to the indication. The puncture site is bandaged by sterile bandage, and the needle is taken out to lessen the possibility of headache after lumbar puncture. The patient is asked to lie for a brief period. It may be half an hour to several hours. Structures penetrated by the lumbar puncture. That is important to us. What structure is penetrated? Skin, subcutaneous tissue is here, then supraspinous ligament, then interspinous ligament, ligamentum flavum, those are related to the lamina of the vertebra, epidural space, dura mater. Subdural space is here, it is just a potential space without any bridging vein. Okay, so it is a potential space with minimum or no bridging veins, arachnoid matter and subarachnoid space. Also, if the needle is in the subarachnoid space, then fluid will come out like this. This image I have taken from the Google Images. So credit goes to Google Images. Contraindication of lumbar puncture: increased intracranial pressure. It may cause problem. It may lead to herniation of the tonsil of the cerebellum. Coagulopathy, okay, that is a contraindication. Skin infection at the puncture site. Allergies and hypersensitivity. Uncooperative or agitated patient. Recent spinal injury or spinal surgery. So these are the contraindications. Okay, follow-up is very important. Follow-up, we just discussed that. Patients are frequently monitored for a short while. We assess the pulse, heart, the vital signs, heart rate, pulse. Okay, the respiratory rate. We look at the temperature. Okay, all the vitals. To lessen the possibility of headache following lumbar puncture, patient is often instructed to relax and drink plenty of water. Relaxation should be at least half an hour to several hours. In 1 or 2 days, most people are able to resume their regular activities. Risk and complication: yes, lumbar puncture is generally safe, but do carry some risk, like infection, particularly if the area of the skin where we will push the needle that is infected with cellulitis, then infection will be spreaded. Bleeding may be due to the coagulopathy, maybe due to the lack of the clotting factors. Post-procedure headache, there is a possibility. So that's why a person should lie on the bed after the procedure. He or she may take a cup of tea or coffee. Okay, if they can sit. Okay. So post-procedure headache, nerve damage. So we may get pain along the distribution of the nerve because our lower vertebral canal contain nerve roots and phylum terminally a pial fold. So there may be nerve damage. Cerebrospinal fluid leakage may happen from the site of lumbar puncture. Usually it disappears, but if it continuously leaking, then a few drops of blood of the patient is injected to that site so that blood will clot and it will block the passage for the CSF to come out. Allergic reaction, we discussed. Allergic reaction should be a complication. It may be due to iodine-based radiological substance. It may be antibiotic, maybe anesthetic, maybe anti-cancer drug. So we may have allergic possibility. Okay, and that's all about the lumbar puncture. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.